Hey everyone! Did you know that approximately 15% of cats are affected by hypertrophic cardiomyopathy or HCM? And about 11% of these cats may develop arterial thromboembolism, also known as ATE, over a 10-year period. In this video, we're diving into the recent prospective double-blinded SuperCAT study, which compared two therapies, Clopidogrel versus Rivaroxaban, to prevent recurrence of AT in cats. Historically, aspirin was used for thromboprophylaxis in cats. However, the FAT-CAT study, published in 2015, demonstrated that Clopidogrel was significantly more effective than aspirin in preventing recurrent ATE and improving survival. This led to Clopidogrel becoming the preferred antithrombotic agent in feline patients. Now, Rivaroxaban, a newer oral anticoagulant that directly inhibits factor Xa, offers a different mechanism of action and has shown efficacy in human patients with similar cardiovascular risks. So, veterinary researchers wanted to see, could Rivaroxaban outperform Clopidogrel in cats? The SuperCAT study enrolled 45 cats across veterinary specialty hospitals in the US and UK. These cats had recently survived an ATE event and were randomized to receive either Clopidogrel at 18.75 milligrams by mouth every 24 hours or Rivaroxaban at 2.5 milligrams every 24 hours. The cats were followed for a maximum of 2 years or until either ATE recurrence or death occurred. So, what did they find? The results showed no significant difference between the two groups. ATE recurrence occurred in 7 of 19 cats, or 37% in the Clopidogrel group, and 10 of 26 cats, or 39% in the Rivaroxaban group. The median time to recurrence was 663 days for Clopidogrel and 513 days for Rivaroxaban, and this difference was not statistically significant. Overall survival times were also similar between the two groups, with median survival of 335 days for cats treated with Clopidogrel and 296 days for those treated with Rivaroxaban. This difference was not statistically significant either. Compared to previous studies, both drugs performed better than aspirin, significantly extending the time cats remain free from clots. Now, you might be wondering, if both drugs perform similarly alone, could combining them be the ultimate strategy? The short answer is we don't know yet. Until a controlled clinical trial directly compares dual therapy to monotherapy, we can't say for sure whether combining Clopidogrel and Rivaroxaban is truly superior. A retrospective study published in 2021 looked at 32 cats receiving dual therapy with both Clopidogrel and Rivaroxaban. Of the 18 cats that started dual therapy after an ATE event, only 3, or 16.7%, experienced a recurrence. Cats without previous ATE that were started on dual therapy due to visible heart clots or spontaneous echo contrast did not develop new ATE episodes. Adverse events were minimal and manageable, mostly minor bleeding episodes that didn't require hospitalization. However, it's important to note that this dual therapy study was retrospective, it lacked a control group, and was not blinded, making it less robust than the SuperCAT or FAT-CAT studies. The SuperCAT study had several strengths, including its prospective double-blinded design and standardized dosing. However, limitations included a smaller sample size than initially planned and potentially variability in tablet splitting, which could affect dosing accuracy. Regarding guidelines, the ACVAM consensus statement published in 2020 before the SuperCAT and dual therapy studies were published recommends initiating clopidogrel as soon as the cat can tolerate oral medications, with an initial loading dose of 75 milligrams by mouth, followed by 18.75 milligrams every 24 hours. They also suggest that Rivaroxaban can be used in combination with clopidogrel. The curative guidelines published in 2019 recommend long-term use of clopidogrel for cats at risk for ATE and does not specifically mention the dual therapy in cats post-ATE events. These recommendations were mainly based on the Fat Cat study and expert opinion. So, what is the bottom line? It is fair to conclude that both clopidogrel and Rivaroxaban alone delay ATE recurrence in a similar manner and outperform aspirin therapy. Dual therapy with clopidogrel and Rivaroxaban is promising and relatively safe, but further research is crucial before we can confirm that this approach is superior to monotherapy. It is clear we shouldn't automatically euthanize cats presenting with ATE because a subset of these cats can recover and enjoy a good quality of life for a significant period afterward. For example, in the SuperCAT study, overall survival times averaged around 1 year, with a median time to ATE recurrence exceeding 500 days, suggesting a substantial potential for good quality of life following the first ATE episode if a cat survived it. So, keep these insights in mind when managing your feline cardiomyopathy patients. And if you'd like to learn more about using lactate and glucose differentials to diagnose feline ATE, check out this next YouTube video. Thanks for tuning in, and I'll see you next time. Bye-bye.